Over the past year and a half, we've really strived to educate our referring dentists, as well as dental hygienists and assistants across Windsor, Essex, and Chatham, that the perfect age is 7 years old. And
Okay.
really, the important thing to remember is that at 7, most of the kids aren't going to need any treatment.
Right.
But there's that narrow window of time where there are certain things that we have to treat before 9 or 10 years old, where some of those problems with the jaws or with the teeth can't be corrected until later on.
Yeah.
So we want to make sure that at least for those patients, we're seeing them, we're identifying those problems, and we're treating it when
Yeah.
we're supposed to.
Makes sense. Makes sense. What are some of those early major signs that parents should look for?
The main one that we really try to educate our parents with is an underbite.
Okay.
So that's essentially when the lower jaw sits ahead of the top jaw.
Right.
And the problem with that is after around 9 or 10 years old, that upper jaw really cannot be influenced to grow anymore.
Okay.
So all the
Yeah.
things that we'd want to do to it
Mm-hmm.
really won't work. And if we miss that window of opportunity to treat it, then those same patients are for sure going to need some type of jaw surgery once they're done growing later on in order to correct their bite.
Right.
And another skeletal problem is kind of the same thing, but more from left to right. So kind of when the lower jaw or the chin is deviated or off to one side, which is
Okay.
just called a crossbite.
Crossbite. Yeah.
And it's the same thing with that. If we don't treat it before 9, 10, 11 years old, we find that actually one side of the jaw will grow larger than the other. And again, it's something that can only be corrected with surgery later on.
Right.
And the interesting part with that is, even though we can correct where the actual jaw is, sometimes the soft tissue like the nose, the lips, the chin, they never really look normal as they're supposed to.
Right.
So simple preventative procedures that we
Yeah.
can
Getting
do
it,
at
the
7
growth.
or 8,
Exactly. Yeah.
can really prevent a lot of more complex problems later.
Okay. Awesome.
And, you know, mainly from a dental standpoint, we get this a lot from new moms. Uh, the big thing is making sure the left and right side of the mouth match each other.
Right.
So if one side on the left is coming in, one tooth, the other tooth on the other side should also be coming in at the same
Yeah.
time. And then the obvious ones like major spacing or major crowding where teeth are overlapping each other.
Right.
Those are really reasons for someone to, pick up the phone, call their orthodontist, make an appointment,
Yeah.
and have it checked out.
How do you determine if they should have treatment now or when they should wait for the appropriate growth?
With those issues that we talked about before, those are things that are going to be done ASAP.
Okay.
Okay, and when we do them, it's done as a phase 1, where we're really only correcting that specific problem.
Right.
So we're not doing Hollywood smiles at 7 years old.
Right.
It's really
Yeah.
just that specific skeletal problem. And the majority of those kids will actually need a second phase or part 2 of treatment to correct everything else about their teeth later on.
Okay.
Now, there's a lot of other issues where, the scientific research and the highest levels of evidence shows that it really doesn't make a difference if we treat it early or later. And it's our practice philosophy at Abraham Orthodontics that we wait to treat those. We'll want to treat them all a little bit later on,
Right.
closer to when all the permanent teeth come in. So for those kids that really don't need anything just yet or don't need that phase 1, we have a great Growing Smiles program where
Okay.
we see the kids every 6 months to a year.
Okay.
We check on their teeth, check on their growth to really see how things are developing
Yeah.
and making sure that we don't miss any opportune time to treat anything,
Okay,
to treat
yeah.
any issues that come up. And we do that service at no charge for families.
Yeah.
So they come in yearly, and it creates a really nice dynamic with our family dentists so that, they know that when it comes to
Yeah.
the growth and development of the children, that someone's looking after it. And, making sure that if any issues come up, we're right there to see them.
Yeah. That's great. That's great. How early can a child wear braces?
Again, it really depends. For somebody to have braces as a phase 1, so again, we're looking at around 7, 8 years old.
Yeah.
It's usually braces on the front 4 teeth. And there are specific issues where that may need to be done, mostly to rearrange the teeth if they're coming in funny positions. But I think most of the time when kids have, braces at that young of
Right.
an age, it's more of an elective thing. So it's something that we know that we can correct it later on,
Okay.
but sometimes the parents choose to correct it now, and the two main reasons could be one is just from bullying or more from a self-esteem aspect for their
Right.
child if they're affected by it.
Yeah.
And the second reason would be if they're really prone to trauma. So the one thing is if they have a really large overbite and the
Right.
teeth stick out, and there's some concerns that there's going to be some accidents on those teeth, that might be something where we would do it early.
Okay.
But for the most part, like we said before, it's really important for us to educate our parents and tell them that whether we do it now or later for the majority of things, there's really not going to be a difference.
Okay.
So we want to be as efficient as possible in order to do everything all at once in a short 2-year span
Right.
when they're of age.
I'm sure a lot of parents ask you if it's more expensive to do it now or do phase 1 now and phase 2 later.
Traditionally and technically, yes,
Okay.
it is more expensive. Again, our office philosophy is a little bit different.
Okay.
So for us, what we do is we essentially take our regular full treatment fee, and if a phase 1 is needed, we just apply a portion of that full fee now and the rest of it
Okay.
later on.
That's great.
Normally what's done is that there's the full fee later on and then another fee
Right.
for phase 1, which
Yeah.
can become costly for parents at the end of the day. So, and we really do this because we really want to ensure that when we are doing something for a phase 1, we know that we have to do it.
Right.
We know that it's going to be in the benefit of the
In the best
patient and the
interest.
family
Exactly.
in order to do it for them so that we're not wasting anyone's time or, more importantly, their money.
Okay. Awesome.